A lot of people want to bet on the COVID vaccine plays, but I think that's a mug's game. We don't need 30 different vaccines. We need maybe 2 or 3 at most. Those are bad odds when you consider that dozens of companies are competing here. Think of the vaccine race as a gold rush. The best way to get rich in a gold rush is not with the miners. It's with the companies that sell picks and pans and shovels. And that's why I recommended Thermo Fisher, TMO, and Danaher DHR a month ago. And, well, actually, repeatedly done. They're both up nicely in the wake of some very good earnings. So tonight I've got a new one for you. It's called PerkinElmer. It's a leading maker of life sciences and diagnostic equipment. Here's a stock that's been a terrific performer in the age of COVID. PerkinElmer is one of the first companies to get emergency authorization for the coronavirus PCR test back in March, followed by an antibody test in May. And a few weeks ago, they got approval for a dry blood spot-based antibody test. When PerkinElmer reported at the end of July, the company shot the lights out, delivering a gigantic top and bottom line beat. While some of that's already baked in, given the stock's nearly doubled from the March lows, I think it might have more room to run. But don't take it from me. Let's check in with Dr. Prahlad Singh. He's the president and CEO of PerkinElmer. To get a better sense of how his company's doing, where it's headed, Dr. Singh, welcome to Mad Money.
Thank you for having me on the show, Jim.
All right, Doctor, we've got to get right down to this. A lot of people at home are saying, you know, how is it possible that we still don't have enough testing? How is it possible that we don't have enough machines? How hard are they to make, sir?
So it's not the ability to make the tests. I think the challenge is really to provide turnkey solutions so that there's a rapid turnaround time and the full workflow solutions are available for our customers. And this is why at the beginning of this pandemic, Jim, we were able to leverage our full workflow solution and our capabilities around the globe to provide the full solution. So for example, when we look at COVID testing, we don't look at it as one test, but we look at it as a full solution. So for example, when you're directly testing for the antigen, you need the extraction, you need the automated prep, and then you need the RT-PCR. We have been fortunate that we've got capabilities across the globe that allows us to provide the full workflow solution for our customers.
Okay, well,
similarly, on the serology side, we've been able to do the same.
All right, well, let's talk about the deal that you have in Arizona. You know, it says the governor announced, this is July 9th, today, a strategic collaboration with Sonora Quest Labs, market share Dynamics Lab in Arizona is the leader, with PerkinElmer. Are you doing more of these deals? Because I was thinking, holy cow, every college in this country should do this kind of deal with you.
Yes, Jim, we are actually doing it with a lot of states across the country and also across the globe. You know, you might have seen the press release that we have with Wales. Similarly, there are several other governments and state entities where we are partnering with our customers in the state and in some cases directly with the state labs to bring our full solutions to our customers.
Now, I think it's important in this age of where there's such geopolitical tension, you have always had a great relationship with China. And you, what, do serology in China right now and extraction PCR serology?
So right now, we are not providing any solutions domestically in China, but we are leveraging some of our capabilities and our presence in China to bring products into other regions around the world, in Asia and Europe.
Oh, I got it. Okay, because I was looking at that help combat COVID-19 across the globe from the recent presentation you guys did. Now, yeah. J.P. Morgan has a piece that just came out, which just says basically, be careful. There are many companies in PCR. It's entirely possible that it's now overcrowded and that PerkinElmer it's had its big move. See, to me, after listening to you, I don't see why anyone would think that you're apples to apples. You're doing a customer-driven product. The other guys may have something, a machine, but they're not offering customer-driven product.
That's a very good point, Jim. I mean, again, as we look at testing, you know, it is not just the availability of a PCR test. You know, anybody can make a PCR test, right. But there are several other elements to it that play a role. And this is where we excel. You know, over the past decade, we have been building capabilities around this, Jim. And, you know, whether it is around diagnostics or life sciences, we are at the early stages of this growth. And as COVID has become a point where we've been able to bring all of these solutions to fore, you need the extraction capability. Without that, we are not going to be able to do the RT-PCR tests as it plays out today. And that's where, today, for example, we launched our Explorer automated workstations, which brings automation in a modular format so that our customers can do up to 10,000 samples per day per unit. Wow. And this is the strength that we bring to our customers.
So when you get up in the morning and you read that Yale has a saliva test that they are going to give away, is that something that you say, uh-oh, PerkinElmer is going to be threatened by that?
Actually, that's a very good example of an innovation that helps us. You might be aware, about 8 to 12 weeks ago, we worked with our partners at Rutgers, and they also brought a saliva test to the market, right? But the thing is, even that's a mode of collection. You still need to provide the automation to scale this up to be able to do thousands of tests per day. And you will always need the RT-PCR test. So while it's a great innovation, it doesn't exclude all the other pieces of the puzzle that are needed for testing to be done at a large scale level.
I wish the journalists would be as clear as you were just now. A lot of people are getting this story wrong, so I really appreciate you coming on Mad Money, sir. Good to see you.
Thank you very much, Jim.
Okay, that's Dr. Prahlad Singh, President and CEO of PerkinElmer. Did you listen to that? It's not as simple as the saliva and go. The journalists are doing you a disservice. This is a much more complicated situation. Mad Money's back after the break.